Welcome, Black History Month. We're coming to the end of the month, and we wondered about all the activities that we as the EDI-IR working group might want to do. And we started with a launch of some activities more low-key in the department, and had the chance to hear from our guest speaker, who graciously accepted the invitation to come and speak. I wish to say to begin with a Ramadan Mubarak to those who are observing. Also, because the Lunar New Year is happening at the same time, so welcome and celebrations for that. Pretty soon Purim is coming up, so I'll say an early good wishes for that as well. And which one? Lent. And Lent, that's right. And Lent started, that's right. So there we are. We're in the midst of a conflagration of very interesting observations or observances here. And I think that's one of the beautiful things about Canada. Also, some of the challenges that are presented. So I think today we're going to hear a little bit about that. It's really quite an honor to be able to welcome our guest speaker, Dr. Fatimah Jackson-Best, who started here. We were just discussing at McMaster and in the Department of HEI about three and a bit years ago, with a leave to start a family in the middle of that. In the meantime, Dr. Jackson-Best has been doing work. She came first with some of the work that we're about to hear today about anti-Black racism, the experience of migrants here in Canada, Black migrants specifically, and social determinants of health and how that affects health in the community, and has started to do some really interesting work now on Muslim health and the health of Muslim migrants in the same vein. So it's a perfect time for us to hear. I'm really looking forward to learning about more of Dr. Jackson-Best's work. So Fatimah, please, over to you.
All right. Hello, everybody. Good afternoon. Hi. Lots of good familiar faces. All right, everybody. Unfortunately, I believe that I am Generation Z, so I put all my notes on a phone. That's the second time I'm doing it, so please bear with me. But firstly, I want to say good afternoon to everyone. And I want to begin with a sincere thank you to the members of the HEI EDI-IR committee for inviting me to give today's round. Special thanks to Kendra for all of her organization on this. I truly appreciate it. I also want to acknowledge the occasion of Black History Month, which was the catalyst for the invitation. And this month also remains a significant opportunity for us to share and understand experiences of Blackness as it contours our lived experiences, our work, our research, and virtually all aspects of Black lives. So when the organizer asked me to provide a title for today's talk, I admit I had to give it some thought before eventually suggesting that it would be addressing anti-Black racism within the framework of EDI-IR. My feelings about EDI-IR have at times been conflicted, particularly as a Black Muslim woman who recognizes both the potential and the limitations of these frameworks. I don't have to remind anyone here of the assaults on hard-won gains of EDI-IR initiatives that have occurred in the United States and even here in Canada recently. These show how important it is to center equity, diversity, inclusion, and Indigenous reconciliation, and also force us to acknowledge the precarity of this framework when it is met with political agendas that are committed to upending progress. I personally have come to view EDI-IR as a process rather than some kind of end result or an ultimate outcome. As such, I recognize that we will see forward and backward movement, and we have to have committed actors, allies, and advocates who keep the work of EDI-IR centered and relevant and focused on attaining justice for communities that have been made marginal. But the question remains, and the question that I had to think through was, where does the issue of anti-Black racism feature into frameworks of EDI-IR? Does EDI-IR implicitly acknowledge the phenomenon of anti-Black racism? If so, is that enough? Or does anti-Black racism exist on the fringes of EDI-IR frameworks and only rear its head at times of civil and social turmoil, such as the co-occurring COVID-19 pandemic and the summer of 2020's racial reckoning that reminded the world that Black lives still matter? So to begin to address this question, I want to take a moment to share a definition of anti-Black racism. All right, so to begin to address this question, I want to take a moment to share a definition of anti-Black racism that has informed my work over the past several years. It's from Professor Akua Benjamin, who is also a Black woman, and she's a social work scholar, Professor Emeritus of TMU, formerly Ryerson University, and someone who has, in a huge way, influenced many through her scholarship and activism, including myself. Professor Benjamin describes anti-Black racism as the policies and practices rooted in Canadian institutions such as education, healthcare, and justice that mirror and reinforce beliefs, attitudes, prejudice, stereotyping, and/or discrimination towards people of Black African descent. Further, anti-Black racism is rooted in a unique history of colonization and slavery that entails discrimination and prejudice that targets Black populations. The Center for Economic and Social Rights brought attention to the disproportionate racial health inequities in housing, child welfare rates, access to healthcare and education, income, and the application of drug laws, and concluded that anti-Black racism is systemic within Canada. These definitions push us to understand that anti-Black racism is systemic and structural, meaning it is deeply entrenched in all of the institutions I've mentioned, and that these structures are literally built on top of anti-Blackness, which plays out in their policies and practices. The definition also shows that anti-Black racism is personal because it can and does affect Black people on the individual level. This means that we can be subjected to poor treatment from non-Black people because we are Black, and that people can literally be anti-Black regardless of their skin color, ethnicity, immigration, or racialized status. Since anti-Black racism is personal, systemic, and structural, it's important for us to recognize it as a serious threat to the health and well-being of Black people. And of course, that eliminating it in all of its forms is imperative and a project that we all must be part of regardless of race or ethnicity. So this request to speak at today's rounds and the question of how does the issue of anti-Black racism feature into frameworks of EDI-IR led me to think deeply about my own career path and my research endeavors. Like many Black scholars, anti-Black racism has been an omnipresent experience that has impacted my career journey, and it is also a significant variable in much of the research I've conducted. It's not lost on me that when I began my graduate training 15 years ago, give or take a few decades, talking about anti-Black racism was typically done amongst other Black students that I had interned with or who had interned before me or after me, and also amongst our limited faculty who also were Black. I'm encouraged to see a noticeable shift from these kinds of hushed conversations to public talks like the one today, papers and research that acknowledge the many ways that anti-Black racism features across society. This is something to be reflective of and take a lot of pride in. And on the other hand, the reality of anti-Black racism also forces us to confront its insidiousness and to consider how we can acknowledge its presence within progressive frameworks like EDI-IR. One of my core beliefs and a guiding tenet of my research is that we must address and attack anti-Black racism in the same exact way that it functions, systemically, structurally, and personally. To do this, we must develop a laser-sharp awareness of anti-Black racism so that we can anticipate how it shows up and create strategies to address it. Adopting this approach in my research has led to some rich, nuanced explorations of Black mental health from multiple perspectives, and I hope that everyone here and online will indulge me as I share some examples from that work with the intention of providing some guidance and insights on how we can all consider addressing anti-Black racism in our research and our work, and of course in our EDI-IR frameworks. So when I joined McMaster University in actually February 2022, it was Black History Month, I got a wonderful welcome from my chair, indicating that it was such a great time of both New Starts and the month of Black History Month. So I started back then. I came with a program of research that I was engaged in that included a community-based participatory research project called Pathways to Care, which was helmed by an organization called the Black Health Alliance. If you don't know about Black Health Alliance, they're a fabulous charity that operates nationally, but headquartered in Toronto. And I started working with them in 2018. So I led a team there that developed research-informed interventions to help connect Black children, Black youth, and their families and caregivers to mental health services across 6 cities in Ontario. We did this work with an acute awareness of the ways in which anti-Black racism impacts the mental health of many people across Black communities. And this was made easier because my team all identified as Black. We're all Black women. And in addition to that, each of us had loved ones, friends, families, and even some personal experiences that confirmed the entanglement of mental health and anti-Black racism. In 2020, when Pathways to Care launched the findings from a scoping review on the barriers and facilitators to mental health care for Black youth in Canada, ours was the first of its kind to be published. And it was also the first time that data about Black youth's mental health in Canada was consolidated in such a way. We later conducted a mixed method social network analysis across 6 cities in Ontario, and the findings from that research revealed some very important insights about the barriers and facilitators to mental health care that are experienced by Black youth. Most significant to today's discussion, that project provided critical context and insights about the deployment of anti-Black racism at multiple levels of the mental health care system and how this affects the care that Black youth accessed. So in our research, we learned that structural and systemic barriers existed for Black youth before they ever even stepped foot into mental health care spaces. And those barriers ultimately shaped their experiences with the services. A significant area of inquiry of our mixed methods social network analysis was the issue of interagency partnerships in the mental health sector. This focus was informed by evidence that indicates that interagency collaboration, which is an approach to service delivery wherein distinct services collaborate to improve service delivery, recognizing that it is imperative to address barriers to care, enhance continuity of care, and provide culturally responsive care for Black youth. A study by Halbert and colleagues noted that increased interagency collaboration was associated with prioritization of high needs children, more appropriate referrals, and decreased disparities in complex service use between Black and white children. Given that agencies have unique interests, resources, and areas of expertise, collaboration is key to maximizing efficiency, service delivery, and client satisfaction for youth. As a result of greater interagency collaboration between schools and mental health services, for example, children and youth perceived positive impacts such as increased happiness and improvements in academic achievement. However, the Pathways to Care project showed that collaboration and partnership building across Ontario was directly affected by one significant factor, and that was anti-Black racism. We came to understand this through our mixed method social network analysis, and we were confronted almost immediately with the systemic nature of anti-Black racism and how it negatively impacted the mental health care system alongside other external sectors which ultimately impact Black youth. We learned that collaboration between mainstream and Black agencies were quite rare, and that Black agencies disproportionately cited themselves as collaborative partners on mental health projects, but rarely were they ever the lead. And that the lack of interagency communication often resulted in similar work being replicated while systemic causes and marginalized populations like Black youth remained overlooked. So to illustrate this for you, I'm including a figure on interagency partnerships in the mental health sector that's taken from a 2023 publication that we produced around this entire project that focuses on our social network analysis findings, specifically in Toronto. For context, we initiated our mixed method social network analysis the week that COVID-19 was declared a pandemic. You could not have chosen a worse time. But it opened up a lot of possibilities and pathways into this area that we could not have maybe accessed if it wasn't a pandemic. But in any case, we initiated that work in March 2020. And as we all know, from March to April in 2020, the COVID-19 and demand for services in Toronto, the COVID-19 pandemic and demand for services in Toronto were intensifying. Despite that, collaboration between mainstream and Black agencies were quite rare. And when I use mainstream, I mean non-Black-led organizations and agencies. Mainstream agencies were overrepresented and oftentimes connected exclusively to one another and clustered in the center of the network, which you can see illustrated, while most of the Black agencies led on the outskirts of the network, self-connected or isolated. I've also included a second figure on future interagency collaboration. Interestingly, most of our survey respondents working in mainstream agencies did not express interest in future partnerships with Black agencies. Though mainstream agencies outnumbered Black agencies, there was some mainstream Black diversity amongst the largest nodes. There was one Black-focused or Afrocentric community health center located in Scarborough called Taibu Community Health Center. If you don't know about this organization, they're also a fantastic primary care facility doing incredible work around Black health. So this was actually the largest node with 4 incoming connections because it was the agency that was identified most often as a future or desired collaborator. Mainstream agencies primarily demonstrated an interest in collaborating with each other. And these agencies in Toronto were cited as potential collaborators. These findings underscore the importance of fostering and sustaining stronger, more diverse interagency collaborations that could develop and expand culturally responsive care, mental health care for Black youth. Our research also showed that there were practitioner-related barriers that impact Black youth. One of the most relevant of those barriers was a finding that pointed to the lack of anti-Black racism approaches being put into action within existing mental health care services. Our research showed that treatment programs were oftentimes Eurocentric and did not understand the complex needs that Black youth had. This finding was significant for a couple of reasons. When we looked more closely at the data produced from the social network analysis, we saw that in some cases, there were organizations that wanted to embrace anti-racist approaches or frameworks that acknowledge anti-Black racism and work towards eradicating them. But they did not know how to incorporate these into their programs or services in meaningful ways. And the word meaningful is also important to emphasize here because while some organizations claim to be anti-racist and their mission or values are included in their strategic frameworks or project documents or their EDI frameworks, there were no real mechanisms or plans put into place to ensure anti-Blackness was being addressed or checked in concrete ways. While this research finding shows that there is some will to do this work, there were not enough supports for mental health care providers and practitioners to put action behind that will. What this ends up doing is making important issues like anti-Black racism more theoretical, or worse, just a box that people can check off based on simply mentioning it. The reality is that adopting an approach that truly and meaningfully incorporates anti-Black racism is hard work for an organization, which leads me to another key finding from our research that I'd like to share. We also found that mental health care providers and practitioners often face pushback when they try to implement innovative treatments that centered anti-Black racism. It's possible that some reasons for this might have been a lack of support from leadership, a lack of engagement or interest from other staff being overburdened by existing responsibilities at work, or a combination of all these factors and others that I haven't mentioned. But what this finding says to me is that some organizations simply weren't ready or were unwilling to truly engage in the work needed to combat anti-Black racism. And the problem with that is that whether they're ready or not, this need is urgent and it won't go away. In fact, like chronic diseases, anti-Black racism is one of those things that will only worsen if left alone. Now, when we conducted qualitative research, I'm always going to do qualitative research. I'm a qualitative researcher by training. We held some focus groups with groups of Black youth, diverse groups of Black youth who have all access mental health care. And in those focus groups, we overwhelmingly heard that they were encountering negative experiences within the mental health care system. In some cases, Black youth felt dehumanized by their clinicians, which they attributed to conscious and unconscious biases. To illustrate this, I've also included the following quotes and narratives from some of the focus groups The first one, we had several focus groups. This first one is from 2S LGBTQIA focus group, Black youth. And, you know, it really speaks to racial profiling and the fact that the youth had to spend time explaining to their mental health care professional, like, that this is something that is a reality and not just a feeling. It's a known experience that's very common across gender and ethnicity across Black identities. And the second one is also, it's illustrated in the next piece that I'll speak to, but the second quote really, and many others like it, demonstrated a tendency amongst clinicians to discredit and distrust Black youth's complaints regarding mental illness symptoms, particularly when they relate to mood disorders such as ADHD, depression, anxiety, or trauma, while overdiagnosing them with conditions that manifest more psychotic symptoms like schizophrenia and bipolar disorder. Black youth experience difficulties in communicating with and seeking help from clinicians for mental health issues when there is a disconnection between their symptoms and clinicians' beliefs about how symptoms present in Black people. As a potential solution, youth in our study spoke of the desire to have access to more mental health practitioners and service providers who are also Black people. And they believe that having a shared lived experience of Blackness would enable them to focus less on explaining experiences of anti-Black racism and spend more time on the important work of healing. Cumulatively, these findings indicate that anti-Black racism was present across all parts of our study, and this led to the realization that anti-Black racism is both structural and structuring, meaning that it is built into the very fabric of the mental health care sector and system, while it also continuously contours interactions between all of the actors within that sector or system. This includes Black youth clients, and it also includes Black mental health care service providers, many of who shared with us through focus groups that we held with Black service providers specifically, that they had also experienced anti-Black racism from colleagues and management within mainstream mental health organizations and agencies and organizations, which actually led us to another publication that was looking at service providers or in organizational barriers and experience to anti-Black racism that was essentially causing this mass exodus of Black mental health care providers from these agencies and organizations that are largely providing free services and into private practice, which introduces a whole new level of barriers for Black youth, unfortunately. So to bring it back and to start to conclude, while the findings I've shared today come from a project that is focused on the mental health care service sector in Ontario, this information is transferable to many contexts, which includes universities. To understand the nature and function of anti-Black racism means that we must recognize that EDI-IR frameworks may not always acknowledge this phenomenon by default, and that without a concerted effort to identify anti-Black racism that is accompanied by action to undo it, that will render our EDI-IR frameworks as being incomplete. So is this a tall order to fill? Is it a significant task? Is it daunting even? Of course, it absolutely is. But the alternative of continuing to live in a world where hierarchy exists that places one group over another due to the color of their skin is far more worrisome to me. Using EDI-IR pragmatically to be anticipatory, responsive, and accountable to those who have been made most disenfranchised is the actual function of this framework. Perhaps it is also how we can maintain EDI-IR in the face of threats to do away with it altogether. McMaster University and the Department of HEI have taken some really important and bold steps to institutionalize EDI-IR practices that address anti-Black racism at the structural and systemic level. Take, for example, the university's Black faculty cohort hire, which was advanced by the African Caribbean Faculty Association and was done to address the low numbers of Black professors employed at the university. It was this marriage of political and social will that was anchored by action, which actually brought me to the university and led me to share my work with you all today. So this is not lost on me as well that these frameworks with action can have some concrete change. And so thank you so much. I want to thank you all once again, Kendra and the committee, for inviting me and for the opportunity to share my work and my thoughts. And I look forward to any questions that anyone may have. So I don't know if I should stand here. It's just like, oh.
I think stand because I haven't got any questions online.
Let's do it from the host level.
Stay centered.
Okay.
See, I know people can unmute themselves. We could maybe take one from the room while we're getting this
Okay,
set up.
yeah, so thanks, everybody. It's brilliant, very interesting, the crafting of it and beautifully put. I have questions, but I wonder if I should open the floor first to those in the room, and then we can open the floor to others as well. Yeah.
Thank you so much, Dr. Jackson-Best. I feel like every time I hear you speak, it feels like a gift, and I always it's like a new way of seeing things that I thought about. So I really appreciate it. I have a question related to your research project on kind of the work of different mental health agencies and potentially some barriers that they might be facing to supporting Black folks and Black youth in particular. I think from my understanding, just friends who work kind of in these particularly in nonprofit organizations, I feel like there can be a lot of funding related barriers to doing anti-hate work or trying to kind of prioritize anti-oppressive work in general. And I was wondering whether the question of funding donors or otherwise came into the conversations at all.
Can they hear or just?
Yeah, the ceiling mic's wrong.
Okay, perfect. It's a great question. I'm glad that everybody can hear it. And, it was one of when you go into these kinds of research environments or these research projects, you always have a hunch because you are maybe embedded in the context or you've heard things. And Black mental health in Black communities has been something that has been accelerating and being amplified over, at least since I was a graduate student, a master's student up until now, now it's at a yelling point. But I remember when, it was smaller, town halls and engagements with Black communities where people were talking about youth experiencing all types of mental health care challenges and, the kinds of racism that they would also experience when they were accessing organizations and agencies that were diverse or that were mainstream, for lack of a better term. And so funding is something that we anticipated would be a huge issue because we know how the funding landscape and the fact that a lot of the times funding becomes connected to very specific outcomes and checklists that you have to fulfill. So you need to have a 10-week trauma-informed mental health care program, and you need to have at least 10 participants, and you need to do pre and post and X, Y, and Z, right? So we know that a lot of this is we had a feeling that a lot of it would be a lot of the issues would be constrained by funding issues as well. I think that the secondary layer of that that we got to explore was the fact that Black people who were working in Black-led organizations and agencies spoke of not being able to even access a lot of that funding, whether it was from province or from funders who were providing these kinds of this kind of funding to advance programming. And what's interesting, and a point that I always like to make about this project, was that a lot of the mainstream and Black organizations that are doing mental health work are not mental health focused organizations and agencies. They are organizations and agencies that exist to serve and meet the needs of Black people, whether that is issues around food security, mental health, childcare, immigration, related issues, whatever it might be. But because the need is so and was so strong and continues to be so strong for mental health, they pivot to doing mental health care support for Black communities. And also, they do that work because Black communities trust these organizations as first points of contact. So while multiple things are true at the same time, while mainstream organizations are constrained by the funding parameters that they have to exist within, Black-led organizations and agencies are not even getting access to that kind of funding to do this imperative work that they've been entrusted to do at the front lines to support Black youth mental health care. Yeah, so I hope that gives you kind of an indication of the issue of funding, but also the layered complexities of it. You're welcome. Any other questions?
Yeah,
Sure.
Because I'm really struck and it's staying with me the structural and structuring comment, which I think really says an awful lot. And you were referring to the DSM and the overdiagnosis of sort of more severe mental health conditions in Black youth. I'm curious to know, I mean, is there work being done at the DSM level or, you know, in practice guidelines, protocols that could, you know, sort of clarify what's happening structurally so that it doesn't go on structuring the youth who are seeking help, mental health care in those contexts? Does that mean
It does, you know, so I think that one of the most fantastic things that happened kind of early on in this project was that somehow we got an audience with the premier's office. I don't, still to this day, don't know how that happened. But somehow they got their hands on, we had done the scoping review that I mentioned about barriers and facilitators to mental health for Black youth in Canada. And I think they got their hands on it because we also included like an infographic. So it was quite colorful. It was like nice, you know, it's easy to share. And it was spreading like wildfire. So all of a sudden, you know, the president of Black Health Alliance is like, okay, we have to go to Queen's Park. And I thought, Queen's Park, oh my goodness, what are we gonna do there? Like, what's really gonna happen? I don't really want to be there, but I guess this is part of my work. So I took myself and actually one of my researchers, who's now a first year PhD student here at McMaster, and we went, and it was, anyway, that's the way that everything happened with this story for a completely different HEI rounds. But one of the outcomes of that was that the I think he was, I can't remember his exact title, but he was the associate, or he was basically, his portfolio was mental health care and addictions. And so he said, you know, so like what can help? Like, you know, where can we give like some money to like extend and expand these programs? And one of our partners is an organization, is not an organization, a program that runs out of the Center for Addiction and Mental Health. So CAMH is one of our partners, but this program called SAPACY, that's now called Amani. And so it was operating only in Toronto, but it has all the need and the reach of this project extends far beyond what it actually does. Like, it's fantastic. It's been around since I was a Black youth. And so we said, you know, yeah, you know, a few $1 million could definitely help to create satellite SAPACY programs across the province. And you know, the cities that we're doing our research in would be great places to start because we're already doing the research there. And would you know that that actually happened? And so as a result, now we've seen SAPACY become Amani, extend beyond Toronto, and start to challenge a lot of the ways that even the Center for Addiction and Mental Health is, you know, categorizing and care and placing people within the DSM to understand more deeply how anti-Blackness is also playing out in these kinds of circumstances, right? The characterization of Black people as being dangerous or being hostile oftentimes thrusts them into categories that other people from, you know, different ethnic and racial groups may not experience. And when you add gender as well to that, we know that young Black men are disproportionately being, being labeled as being bipolar or schizophrenic, and the use of restraints has become a huge issue. One of my former researchers for Pathways to Care, that's her entire PhD project at the University of Toronto, the use of restraints in Black communities, right? We've seen that there's a disproportionate rate of that. And a lot of that has to do with the ways that Black people and Black people's bodies are literally understood and characterized and then treated. And so I look at Amani, SAPACY oftentimes and think about the ways that this is an attempt to structurally shift and change the ways that mental health care is being administered in a real way that can challenge DSM categories and categorizations that take into account the kinds of baggage and the kinds of characterizations that Black clients and Black patients enter into these kinds of environments with. You're welcome. You're welcome.
Curiosity in the definitions in the DSM, do they ever refer to race?
Off the top of my head, I cannot recall this, Lisa. I feel like I'm in semester. I cannot remember no, I can't remember this one, but I can't say yes or no because I don't want to be wrong. But it's a good point of further inquiry, definitely. Maybe 3 years ago I would have been able to tell you a definitive answer, but I don't know today. I can't recall. All right, you're welcome.
Any questions coming from online at all?
I think if anyone online has a question, if you could raise your hand, I think we can get you to unmute.
I also have a question. So this one is about kind of the framework of EDI-IR overall. I like what really resonated with me in your talk is like this duality of like recognizing the limits of this kind of a framework, but also its promise.
Mhm.
And I feel like that's something that I've been trying to navigate myself, like as I kind of have entered like, or yeah, like as I've become a PhD student and I've been like in these spaces. So I was just wondering whether you could maybe like, expand on anything that has kind of helped you with that, or yeah, kind of balance like being in an institution, but then also bringing like your critical lens.
It's a good question. You know, I think a lot about my aunt, who's actually not my aunt, she's my cousin's wife, but grew up like in a close way. She's worked in the Peel region for years. And so the first time I heard EDI or equity, diversity, inclusion was really from her, and it was a really long time ago. And I didn't know, and she has that kind of, she walks through the world in a way that is like her, that is her. It is her. It comes from an honest place. She's also a Black woman. And so I thought it was just, it made sense as, you know, a teenager and growing up and being in university and thinking about the work she did, it always made sense. But then, you know, we're in a political moment where it takes on different contours. So for me, EDI always had to include Black people because she was a Black woman who was doing that work, right? And she's always going to center the needs of Black communities in her work. But then you come into places where now EDI is like being concretized in different ways, and the ways that it is also being looked at as being a threat, right? So for me, I think that that's why in the beginning I said that I look at EDI as a process, right? And so it's not something that I don't feel that we'll ever get to a point and say, okay, we have now achieved EDI-IR, and that's it. I think that, you know, it necessarily is a process because equity and diversity and inclusion is going to change and require different inputs and different considerations as our societies continue to become more complex and as people make themselves known and make their needs known. So it always has to be a process, and it always has to be ongoing, and there has to be backward movement, unfortunately, because that pushes us to go forward a little bit more. If we're getting into places where we feel comfortable and, you know, we feel as though we've done everything, that's exactly when EDI-IR is under its probably can become under its most brutal attacks, because you become complacent. But if we're looking at it as a process that is continually evolving and meeting the needs of our complex lives, then I think we're in a better position to keep actioning it. And the more that we continue bringing people on and talking about it, creating spaces like this, creating chairs in EDI-IR, creating opportunities for graduate students as well, is going to be incredibly useful for me. One thing that I think about a lot with regard to EDI-IR is how it affects students at McMaster University, and, you know, how many Black students I see in classrooms, how many students of color I see in universities, how many students who come from low-income backgrounds I see in universities, queer students, trans students, etc. This is what EDI has to continue to confront and resolve as we see numbers and as we see and hear from students what their needs are with regard to funding and making a living and being safe on campus, for example. It makes me think a lot about this new research program of research that I'm initiating around Muslim mental health, and specifically looking at mental health outcomes as it pertains to Islamophobia. You know, this is something that as a Black Muslim woman, like, I hear about this all the time. I think about it all the time as well. I think about my own self feeling unsafe, or my earliest experiences with Islamophobia and Islamophobic incidences, like at a very young age, and not understanding why somebody would refer to me as, you know, a racial slur. And so, you know, I'm interested to see and to understand and to fit that exploration also within EDI-IR frameworks, to acknowledge and understand that you know, Muslim communities, Muslim women, Black Muslim women, Muslim men are also, Muslim children and youth are also experiencing a lot of exclusion and, you know, and mental health outcomes as well. So, and I think that if we just action it and we just think about it as something that needs to be ongoing and that requires our participation in whatever capacities, I think that's what keeps me in tune with EDI-IR, and I hope that it also keeps other people in tune with it as well. All right.
Let's see, so are there any questions online? Again, you can raise your hand or clip it in the chat. I suppose that would work as well.
Another question, we go back and forth. Unless somebody else wants. I'm interested in what you were saying about meaningful ways.
Mhm.
I wrote down meaningful ways
Mhm.
and what. And I'm curious about examples that you saw either in the research, or particularly hearing from the Black youth that you interviewed,
Mhm.
whether they saw some examples of meaningful change, or if there were, apart from the excellent work that you did on KT and going to Spark and Heard, are there examples of meaningful ways that you've seen that we should be taking seriously and be looking into more?
That's a good question, Lisa. I mean, so a lot of those focus groups with Black youth happened after the summer of 2020. And so we know, like, after 2020, there was all of these initiatives that had been designed or action to service Black people, which was also really, the whole thing was honestly really the strangest political and social moment that I could have ever done a project like this in. You went from, thinking, oh my gosh, a pandemic has started, we just administered our online survey, is anyone going to answer, to having this overwhelming response from Toronto. It was unbelievable, the amount of service providers that gave insights. And then over the summer, getting calls from like big companies asking if the organization could accept, a donation in like the hundreds of thousands, millions of dollars. I've never seen anything like that. And as a result, because the organization was getting so much attention, we were able to, say like, okay, there's other organizations that can also use like these donations who are doing all kinds of work. And so all that to say, we ended up doing focus groups after that political moment. So some of the youth who were participating had seen a shift from, the kinds of services that they'd experienced and had entered into to like very different services that were a little bit longer, that were more resourced. And so, I think that some of them would characterize that as being meaningful, right? That there was this thrust from Black community that was indicating like, Black people are being killed, mental health is at crisis points, we're in a pandemic, this is worldwide, it's not just happening in America, this is also a Canadian issue, and seeing some material shifts and changes to mental health care service provision in these smaller organizations, whether they were Black or mainstream. And so for me, that is meaningful. And what also remains meaningful is that some of those still continue, right? And some of these have led to longer term mental health care service provision and mental health care service opportunities for Black youth that can see them beyond 10 weeks, and that have ultimately shifted and changed their lives. I think also what has been really meaningful, or what was meaningful that was expressed to us directly through our project, was the ways that we created opportunity and to work directly and be informed specifically by Black youth. So we ended up having, because it was community-based participatory research, we had a youth advisory committee that acted as our governance structure. And that was an innovation that came from one of my researchers. We hadn't thought about it before, and it completely shifted everything. And that youth advisory committee, I mean, I still engage with some of them. Some of them have become therapists themselves. Many of them have gone on to university. Some of them we've written, we've co-authored publications on this project with. And, that for me was a way for us to also do some meaningful work rather than just being kind of like a top-heavy research project that was going into the community. And yes, it's CBPR, but, actually engaging with our community and working alongside our community and being humble was also, I think, it was meaningful for me, I should say. It really shifted the trajectory of how I think about community-based participatory research, and what I will call something a community-based participatory research project versus a community engaged project, right? It's shifted the way that I teach, it's shifted the way that I think about the world, it's shifted the way that I parent. I wasn't a parent when I first started this project. And so it shifted really the way that I interact with my own child, with my family. So, yes, meaningful, there's been meaningful initiatives I believe that we were able to uncover through our focus groups, but there's also been a lot of meaningful shifts and changes, I think, in our lives professionally and personally for the organization and for this project that, you know, I'm humbled by every single day. All right.
Okay, anything online? Last chance to go online.
Love to hear more. People who I work with, who I encourage, you know, and even myself, like who are thinking about doing community engaged, like participatory research. It seems scary, daunting,
A lot of work.
slow, a lot of work. Do you think it's, well, I think you would say it's worth it. How can we, I don't know, how should we be thinking about it? Should we be thinking about it differently rather than always through this sort of problematization lens of it's gonna be too hard, it's gonna take too long, we're not able to.
Well, I think that recognizing that it is hard and it does take a long time is like, I think being honest about it is good. And I think also being honest about whether or not your project needs to be or truly is a community-based participatory research project is a conversation that can anchor any project, any research project. That being said, it is extremely worthwhile if you have the time, if you have the funding, and if you have funders who we were lucky enough to have that were okay with, you know, something being a little bit behind, you know, because one of our outcomes being behind because we needed to collect more data or because we were doing online focus groups and, you know, we initially were looking to engage with people directly, but because of a pandemic, we were unable to. So, you know, I think it really, to me, it is a worthwhile endeavor. But I also make a distinction between community-based participatory research, which has very clear outlines and clear checkpoints that you need to meet, versus community-engaged research. And so I tell my graduate students all the time, you may want to do a CBPR research project for your PhD project, which is incredibly important, and it would of course be a wonderful thing, but within the timeline that you have, is it going to put you behind? Do you have an extra 2 years to add to your PhD journey? I remember the PhD journey and I did not have an extra 2 years. And so, you know, I think I talk to them often about the difference between community engaged work, where you're engaging with community, you're consulting with community, but it's at a different level and there are different expectations and there are different responsibilities that are involved that you decide alongside community. So one way that we're thinking about this for the research that I've been doing around mental health outcomes and Islamophobia and gendered Islamophobia in communities is essentially working alongside key community partners who are, you know, determining what kind of position they want to play in our project. Do they want to be more of a governance structure, or do they want to have access to the data so that they can use it and fashion it in ways that will increase their opportunities to receive funding, increase their reach, right? So, you know, you don't have to do everything all at once, and that's okay. That's okay. But I think that just being very clear about what you're doing and what you're not doing is probably the most important thing. And not every project needs to be CBPR. That being said, if you're working with community, like, it's incumbent upon us to engage respectfully, obviously, pragmatically, intentionally, meaningfully, right? And so, you know, again, it always comes down to your intention about everything and how you're actioning that intention.
A lot of really good advice on the topic, so yeah. Any last comments or questions? In case I feel like I've grilled you and it's you're all thinking. Really, really fascinating. It's such an important topic. I hope we will get a chance to hear from you again more about the knowledge translation aspect of what you did, and then the way these methodologies play out. And I think we're as HEI, I think we've been wondering about and thinking about all methods, not just the qualitative methods, but all of methodological approaches, quantitative and qualitative, of doing the kind of participatory engagement that you've just described and that you carried out so beautifully. And I hope that for graduate students who are thinking about it, that one way that you'll think about approaching that is working with people who are already engaged in it. So you don't have to be the one who initiates it if the project is that large. But considering how much work goes into such projects, being involved with existing projects is probably a healthy way to get the experience, not have to do it by yourself and not have to start from scratch. And then the knowledge mobilization, all of that's so interesting. So thank you so much. I think you've brought us to that threshold where Black History Month becomes, Black opportunity and doesn't just end there. I think it's incumbent upon all of us to think about this as a continuing celebration, and not just something that happens in February. So I hope we'll see much more and look forward to more of your work. Big thanks to Kendra. Gabby, yeah, who's not in the room. I don't know, JB, were you involved? Yes, no, okay. Caitlin, I think you, Lawrence, you've been part of this, and of course, Aaron, and I think Kendall online as well. Thank you all so much for doing the planning and organizing, making sure that we moved into a new year in this wonderful celebratory way. Thank you so much. Thank you.